Hi, I'm Dr. Chris Noonan. I'm an orthopedic spine surgeon here at NeuroSpine Institute, and I just wanted to spend a few minutes telling you what you could expect when you come and see us here. If you come and see us as a patient, our goal is to give you a very professional, highly individualized evaluation. We would do that first by listening to you, finding out your history or your story, how you got to where you are, and what your problems were. In doing that, we would evaluate you with an examination, look at whatever studies that you need or whatever we would need to order, and then come up with a diagnosis and try and define exactly what your problem was. Once we can do that, we often come up with a really nice specialized plan for you as a patient to try and help you basically get your life back. One of the better parts of my job as an orthopedic surgeon is the ability I have to talk to people on a daily basis. They come in, I get to sit down, I get to interact with them, I get to hear their story. And those stories are phenomenal, all the way from the World War II veterans that I've spoken to over the years to your grandmother or grandfather or whoever, those people who grew up in Southern Oregon when they were in a cabin that had dirt floors. I mean, it's a phenomenal amount of stories that I've heard over the years, and that truly is one of the better parts of my job. I love being an orthopedic surgeon because what it does is it gives me an ability to take care of patients when they have acute problems, help them really get over that problem, and then get back on with their life. There are people who have broken wrists, broken ankles, in my business slipped discs, and we can help get them over those problems and they can get better and move on with their life. And that's one of the things I like. Spine surgery in particular is very exacting and also very delicate. So kind of the combination and the balance of those two areas is one of the things I really love about spine surgery. As an orthopedic surgeon, there are parts of my job that are really fun and challenging. The fun parts of the job is some of the new learning that we have to do. And that learning is driven by a lot of the new technologies that are constantly coming out. The technology that was available 25 years ago is very passé or old at this stage, and you would never want to use some of that technology currently. The current technology is causing a revolution basically in a lot of medicine as well as in spine surgery. One of those technologies that I've developed somewhat of an expertise in is disc replacements. One of the common areas that we'll have problems is in our cervical spine or our neck. If we have a problem there with a disc, we will often develop arm pain, arm numbness or weakness, and that can be very disabling. It's typically from a disc that becomes degenerated. We can grow some bone spurs, or we can even slip or rupture a disc. That's what will give us the arm pain. The typical way that we can treat that is through a cervical fusion, which we come in through the front, and the classic name is an anterior cervical discectomy and fusion. We clean out the disc all the way back to the spinal cord and the nerves using a microscope to keep it as small as possible and allow us to visualize and be very delicate with what we need to do back around the spinal cord. After we've cleaned everything out and we've decompressed the spinal cord and the nerves really well, we fill that disc with either a block of bone for a fusion, or now the new technology is a disc replacement. A disc replacement allows patients to maintain motion at that disc so they hopefully won't develop degenerative changes or bone spurs or arthritis at the disc above and or below. Classically, we've done a fair amount of cervical discectomies and fusions. It's a great procedure, but the disc replacement's hopefully changing that as we go forward. Disc replacements are not for everyone. The anterior cervical discectomy and fusions that we do are a great procedure, and they are appropriate in some situations. There are some patients though who may do very well with the disc replacement, and if you think you may qualify or be one of those patients, we're more than happy to see you. Call, make an appointment, and come on in. We at NeuroSpine Institute are here to help you try and get your life back.